Understanding brain tumors involves recognizing their types, symptoms, and causes. A brain tumor is an abnormal growth of cells in the brain. These growths can be benign, meaning non-cancerous, or malignant, which are cancerous. Tumors can start in the brain, known as primary brain tumors, or spread from other parts of the body, referred to as secondary or metastatic brain tumors. The implications of brain tumors vary greatly based on size, type, and location within the brain. The most common types of brain tumors include gliomas and meningiomas. Gliomas, which originate in the glial cells that support nerve cells in the brain, are particularly prevalent, accounting for about 46.8% of cases, in specific studies like the one conducted at Aga Khan University Hospital. Meningiomas, arising from the membranes that cover the brain and spinal cord, are also common, representing 21.2% of cases in the same study. Symptoms of brain tumors can differ depending on the tumor's location and size. Common signs include persistent headaches, dizziness, nausea, and seizures. Some individuals may experience memory loss, changes in personality, or impaired vision. Because these symptoms can mimic other medical conditions, they often go unnoticed until the tumor has grown significantly. The causes of brain tumors are not entirely understood. However, several factors are known to contribute to their development. Genetic factors such as inherited conditions like neurofibromatosis can increase risk. Environmental influences such as exposure to ionizing radiation have also been implicated. In some regions of Pakistan, high-altitude living conditions have been associated with an increased prevalence of brain tumors, highlighting the need for further research into these environmental factors. Diagnosing a brain tumor involves several sophisticated techniques. The most common diagnostic tools are imaging tests like magnetic resonance imaging, or MRI, and computed tomography, or CT scans. These imaging techniques help doctors visualize the tumor's size, location, and impact on surrounding brain tissue, which is crucial for planning treatment. MRI scans are particularly effective in providing detailed images of the brain's structure. They use magnetic fields and radio waves to produce comprehensive images, which are vital for identifying the presence of a tumor. CT scans, on the other hand, employ X-rays to create cross-sectional images of the brain, offering a different perspective that can complement MRI findings. Biopsies may also be conducted to obtain a sample of the tumor tissue. This sample is then analyzed to determine the type of tumor and its malignancy. However, obtaining a biopsy can be a complex and risky procedure due to the brain's sensitive nature and the tumor's location. Despite these advanced diagnostic techniques, challenges remain. Access to these technologies can be limited in some regions of Pakistan, delaying diagnosis and treatment. Moreover, the symptoms of brain tumors often overlap with less severe conditions, which can lead to misdiagnosis. Thus, awareness and education among both healthcare providers and the public are crucial for early detection and improved outcomes. Treatment for brain tumors typically involves a combination of surgery, chemotherapy, and radiotherapy. The choice of treatment depends on several factors, including the type, size, and location of the tumor, as well as the patient's overall health. Surgery is often the first line of treatment for accessible tumors, aiming to remove as much of the tumor as possible while minimizing damage to surrounding healthy tissue. In cases where surgery cannot remove the entire tumor, or if the tumor is inoperable, chemotherapy and radiotherapy are used. Chemotherapy involves the use of drugs to kill or slow the growth of cancer cells and is sometimes used in conjunction with other treatments. Radiotherapy uses high-energy beams to target and destroy cancer cells, often following surgery to eliminate any remaining tumor cells. In Pakistan, the availability of these treatments can vary significantly depending on geographic and economic factors. According to studies, a significant proportion of patients at Aga Khan University Hospital received no adjuvant therapy, highlighting a need for improved access to comprehensive cancer care. Additionally, the high cost of treatment poses a financial burden, making it critical to develop support systems to help patients manage these expenses. Emerging treatments, such as targeted therapy and immunotherapy, offer new hope for patients with brain tumors. However, these advanced treatments require further research and development to become widely available. Efforts to improve healthcare infrastructure and increase funding for cancer treatment are essential to ensure equitable access to these life-saving therapies. Living with a brain tumor poses significant challenges, affecting a person's physical, psychological, and social well-being. Physically, patients may experience fatigue, headaches, and other debilitating symptoms. Psychologically, the fear of disease progression and uncertainty about the future can lead to anxiety and depression, not only in patients but also in their caregivers. Family support and spirituality have been identified as crucial coping mechanisms for patients in Pakistan. The presence of a strong family network can provide emotional support, helping patients navigate the challenges of treatment and recovery. Spirituality and religious beliefs offer comfort and hope, playing a vital role in coping with the stress of living with a brain tumor. Financial challenges add to the burden, as treatment costs can be prohibitive, especially for families with limited income. Support groups, both formal and informal, can provide a platform for patients and families to share experiences and strategies for managing these financial and emotional stresses. Counseling services and psychological support are also crucial in helping patients and families cope with the mental health impacts of brain tumors. Raising awareness about brain tumors and the importance of early detection is essential for improving outcomes. Educational initiatives aimed at both the public and healthcare providers can help reduce stigma and promote timely diagnosis and treatment. Ultimately, a multifaceted approach that includes medical, psychological, and social support is necessary to improve the quality of life for brain tumor patients and their families.